Now, we're joined via Skype, the national chairman of the Coalition of NGOs in Health, Gabriel Bernaku, is standing by. Good afternoon to you, sir.
Yeah, good afternoon, Aisha. How are you doing?
Very well, and hoping that we are able to contain this disease. But how are you receiving news that Ghana has recorded her first 2 cases?
Yeah, thank you. We thank you and thank the various media who have joined this to ensure that people get adequate information on what the government is doing and the Ministry of Health. We have issued a communique to all our regional executives, our 55 regional executives in all the 10 regions now, and we have asked them to support the Ghana Health Service in terms of complementing their effort in social mobilization. We have also communicated through the media and other platforms to get community, especially traditional authorities, to support this educational program. And we also do call on the Christian Council and the other recognized body, religious bodies, to begin to engage the Ghana Health Service from all facets of their structure. And we cannot wait for them to engage properly, but we need to also encourage everybody to also engage. So yes, we receive it as one of normal terms because we have already gotten information from across the globe, and we have received the WHO information about the pandemic, and therefore Ghana could not have done anything than to be properly prepared. So we have received it in good faith. We pray that it doesn't spread as it does in other countries, but we want to encourage everybody listening to observe the protocols of ensuring that your safety is at your hand, observe the basic cleanliness, and also to ensure that you report to the nearest health facility if you suspect anything. So yes, it's our responsibility as Ghanaians to do more than before, and it is also our responsibility to ensure that government release money on time to support the regional Ghana Health Service teams, to also support the districts, and especially if you notice, the coalition has been talking about 55 districts in Ghana who are sharing borders with other countries. We need to strengthen and put in place physical infrastructure that we can see and that people can know that they can go there for services. And that is what we want to talk about now.
Doc, there are suggestions that we should ban flights coming from all affected countries and also close our borders to neighboring countries. So what's your recommendation to this?
I'm not an economist, but the public health, yes, we can still manage it if we really mean business, if we are really interested in protecting every Ghanaian, and if we are really interested to strengthen our health system. We can still use the money the president has allocated for country to strengthen our borders and the airport, and we can have a temporary system that can detain people for some time, and then we release them. Somebody will say our strength is not too strong to be able to veto that. It will affect our international relations and other things. But we can do more and strengthen our human and health systems that can contain the situation right away from airport. They should not get in touch with their family or their business partners, but they can have a temporary place where they can be observed for some time before they can do that.
So banning flights and shutting our borders is not an option now?
Borders, yes, can be managed in a way. Flight, it has to do with international diplomatic protocols and other things, And I cannot talk about that. The president has the sole responsibility to be able to negotiate
But
for
what
that.
is the right thing to do? I mean, you may not have the right to do that, but as a health expert, you know what the right thing should be.
That's one of the alternatives I just told you, that we can have a structure to quarantine people for some time, observe them with all the protocols. If you observe the cases we have recorded, they came in within some short period before the symptoms started. So we could have that. But if the president, in his own wisdom, think that he can veto and ensure that we prevent any international flights London, yes, that would be excellent. But there are options and opportunities for us to take.
What should the Ghana Health Service do, Doc, about the places that are usually crowded? I'm talking about schools, churches, I'm talking about public events and what have you.
The Ghana Health Service is capable of providing adequate and timely information if they are supported. So the Minister of Health, Minister of Finance should immediately speed up the arrangement to release the needed resources to the regional Ghana Health Services. I believe they can do a good job in the various regions and districts. The issue has always been political will, political commitment to releasing resources to the Ghana Health Service. Now that we have seen the President's commitment to dedicating $100 million and instructing that it should be released for the preparedness and the management and even for research. If you notice, I'll talk about research severally that Ghana, we are not researching on that. This $100 million could be used to scale up, to prioritize areas that are already tagged as highly prone, and the other areas that we can roll out educational programs and other areas that we can go into research so that we can learn from it and get more information how to manage the future. And the issue of tracer is very critical. Once we have these two cases, it is most likely and probable that they would have already infected other people who are also within their incubation or who are also on their way to infecting other people. So there's the need for adequate resourcing of the Ghana Health Service to be able to do a good job, including our research institutions.
Doc, there are suggestions that there should be a directive to actually ban public events, funerals, weddings, and what have you, and also shut down our schools for the time being. What's your position on this?
That may not be a good strategy. Health is also social, and therefore you cannot totally ban. What we have lacked and what we have fallen behind is that we have not educated people enough to observe the principles of safety and healthy lifestyle living. If we activate the educational program, there will be very little crisis if should it happen to the other parts. So what I really recommend the Ghana Health Service to do is to capacitate their staff, community health nurses, public health nurses, the health promotion unit, converting all the messages into local languages and populating them, integrating the Ministry of Information Service Department to complement the effort of the Ghana Health Service, I think can make a very good inroads to educate people so that funerals greeting will be stopped, even though funeral can be performed, weddings can be performed without necessarily allowing the creating problems. But the responsibility lies on people getting adequate information, and they can be able to take that to change their lifestyle. So we could activate some of the state laws of public noise or anything that have repercussion on the public safety. But the most and the best strategy is to intensify our behavior risk communication and social mobilization and engagement.
Well, some few weeks ago when we recorded that case that proved negative in Kolebo, we had some frontline health workers complaining about how unprotected they are whilst at work. Has that changed? What is your checks revealing?
As of yesterday, it has not changed much. And that's why I keep on advocating that the president should check to ensure that the Minister of Finance release funds to the Ghana Health Service immediately. The situation is still remain unchanged. There has been little in my knowledge, and I'm connected with all the regions. I know what I'm talking about. Even right now, as I'm speaking to you, I am not in Accra, I'm in Takoradi. And last week I was in the north, and this week I'm in Takoradi. Monday I will be in Kumasi, and therefore I can 100% tell you that all the issues we have talked about, the inadequate preparedness of Ghana, still remain the fact. And the good news is that the president has spoken 3 times, and there has been changes at the national level. But we want to see this translate into the local level. And the only way to do that is that let's release the money, let's release all the support so that the human resource can be recapacitated, material can be supplied, financial issues can be provided, engagement can be strengthened, and research can follow up with information so that we can learn from it, respond quickly in treatment, in protection, also for the future. And so the only thing we have to do now is to allocate resources to the region.
I'm extremely grateful for your time. Dr. Gabriel Bernaku is president of NGOs in Health. Meanwhile, microbiologist with the University of Ghana, Reverend Professor Kwame Nsego, has revealed that the coronavirus is able to live on surfaces between a period of 2 hours and 9 days. What this means is that if an infected person touches any surface, like tables, doors, chairs, etc., you're likely to also get the virus if you touch it. Listen.
I want to bring in now is that I have learned, I spoke to Joy FM before I came here, and I've learned that one of the people is a Ghanaian, one of the those who tested positive is a Ghanaian. Yes. So we should remove that myth that Africans cannot be infected. We shouldn't go there. There may be other reasons why we don't have that level of infections here as compared to China, Europe, and other places in America. So we need to be careful. So we should close that myth now, now that we have a Ghanaian who has tested positive in our own country. Okay, so now you have normally what you have called an incubation period. If you are infected by a virus, not only viruses, by any infectious agent, there's a time when from infection to a point where you will not show any symptoms. You look just like any of us sitting here where you are not sick. And sometimes these things you can transmit through even though you are not showing any signs, somebody can actually pick it up from you because the virus may be growing in your body, you see. So as the virus grows, maybe it needs to get to a certain level to destroy your respiratory tract to a certain level before you start showing the symptoms. So not having any symptoms doesn't mean you cannot transmit to someone. That's what we call the incubation period. And I think we should also bear in mind that a lot is still, the virus is unfolding and people are still trying to find out how does it really behave. So we should have maximum protection as much as possible. And so that's why they're doing contact tracing. The assumption is that these people sat on the plane. Did they touch anything on the plane? Were their hands somewhere? Were they coughing into the air? And did people inhale when we're coughing? So anything could have happened. So the idea of contact tracing is to make sure that those people are observed over a period of time.
We'll talk about it.
Okay.
So I'm talking about 2 people.
Yes.
2 cases, I'll call them 2 cases. Yes. Before they left their place of origin, wherever they came from, they'll go through certain checks. Left their hotel rooms or homes.
Yes.
They take a cab. Those are the things I want you to take me through, the routine.
Oh, okay, I mean, you said it already. So basically...
I have not said
no, so they probably may have even gone to church or to the mosque before coming, and they went to the airport. they went through the processes. They have gone to it. Probably people buy ticket online, so probably they bought it online. They paid online. When they picked a cab, or they were living with their family. Okay, their family, children will go to school or they will go to work. So let's look at the big picture. And then they have now come to Ghana on the flight. They met people. They picked the cab from the airport home, or somebody picked them. That person would meet another person.
That was Professor Sego with some tips there. My colleague Erasmus Danka has been to the markets and bus terminals. He joins me via phone. Erasmus, good afternoon to you. Tell us more about your findings at the bus terminals and markets.
Good afternoon. We have been going to the various public areas to try to find out people's preparedness towards prevention of coronavirus. Now, we've gone to the Kumasi City Mall, for example, and we've seen that the management itself has put up notices at the various meeting areas to tell people about the do's and don'ts, as well as to show people how to wash your hands and all that. They've also set up some hand sanitizing joints. And so there are tables placed at vantage points where people could sanitize their hands with alcohol-based sanitizers. Those are also started across the mall area. And then they have a public address system which is playing the Ministry of Health's advertisers jingle on the preventive measures on coronavirus. We've also gone to the China Mall, where we found that they placed somebody at the entrance of the mall with an alcohol-based sanitizer, and so as people enter, you get some sprayed onto your palm, and then you rub it before you enter. When you are leaving, they do same for you as well. And we have people distributing face masks as well at the China Mall. Now, we've also been to market areas, and the kind of talk that you find around is that people are really concerned. People are hungry for information, and they believe that it's better late than never. Though they wanted government to be more proactive than it has done now, they believe that this is the time to act. And so people are also doing their own thing. Some are using the elbow greetings, and some are using the leg greetings and all that. So when you want to shake somebody's hand, he says, well, these days they say we shouldn't be shaking hands. Then he gives you the elbow. That's what we found. But we went to Kumasi South Hospital, which is one of the holding areas, is the main holding area for suspected cases of coronavirus in Ashanti region. Now, what they've done there, at the entrance of the hospital, they've barricaded portions of it where people compulsorily have to pass. And they have these thermal guns that they use to check for temperature. And so if your temperature rises above 39, then they refer you to another facility where you are further screened. And there is a holding area which has 4 beds. And there are other wards within that particular holding area where they are supposed to quarantine people, get them tested, and if it turns positive, be able to hold the person for some time. So this is what we found on the field.
Well, quite interesting revelations. Erasmus Danka is our man on the beat, but still in Kumasi, because researcher at the Kumasi Center for Collaborative Research, Dr. Michael Russo, says resources made available by government places Ghana in a position to build modern treatment centers for coronavirus.
A portable testing device which works without electricity, which can be deployed at the borders of Ghana for this testing. I saw it and I was so much happy. This machine, together with the reagent, will not cost more than $11,000. So you will expect that if you can buy 10 of these and position them at various borders and even make it available to the public health laboratories, testing can be done. If you are overwhelmed, KCC Anuguchi is doing excellently well, but because the numbers are small, if you have 100, you do contact tracing 100 to 200 people, the systems will be overwhelmed. So once money is coming in, it's an opportunity for us to be able to increase the testing centers. We need to build the system. I mentioned the other time that our system has not been tested. And if you have not been tested, you wouldn't know how to deal with these cases unless it comes. But you don't also have to wait for these cases to come and cause people to die. So what it means is that the money will have to be in. The KCCR must have its own share of the money. Noguchi must have its own share to boost testing capacity and buy a lot of the equipment, train people, deploy this equipment for people to do the testing.
We're still live on The Pulse. When we return shortly, we'll be telling you how people are cashing in on the coronavirus. Please stay with us.